Hello all, this is just a brief video that I, Daryl Reinicke, CEO, and Megan Tryon, clinical coordinator for our facilities, wanted to share with you today. First, just want to say thank you for all the cooperation and assistance that you're providing us daily at work as we work to keep each other safe and certainly our residents as well, period. We've had some nice celebrations of late, and just want to mention that great turnout for our Mother's Day drive-through. I think that did as much for us as it did for our residents and families, so thank you for that. We've had many nice comments about that. Also, I want to thank all of our nursing staff who helped with the COVID-19 testing that we accomplished last Thursday and Friday. So over 400 tests have been sent in. We'll be getting the results hopefully this week. The minute we get them, we'll be letting you know individually as well. Just wanted to emphasize that safety is critical to us. So please wear the appropriate PPE, do all the kinds of steps and processes not only we have in place, but that the CDC and Department of Health has asked or required that we do to make sure that we're all continuing to be safe at work. And we'll talk a little bit about how you can also be safe outside of work. So again, thank you for what you're doing. Hang in there with us. We're all making the best of it, and I think we're going to do extremely well. I'd like to invite Megan to come up and go over some items that might be of interest to you as well.
Hi everybody. So I'm going to take my gear off here for a minute while I speak. So as Daryl said, great testing events. Thank you to everybody who helped with that. We had a lot of our nursing team who helped. We also had a lot of support staff and intake people working those desks. Thank you to everybody who came in on your day off to get tested in a timely manner. As Daryl mentioned, we're waiting for those results. We'll get them out to everybody as soon as they become available, both staff and residents. In regards to our residents, we're working on some fun approaches to help facilitate some resident visitation with their loved ones in a safe way. As we proceed through this pandemic situation, we expect that this is going to continue for the foreseeable future. So we want to be well prepared to encourage as much interaction in a safe way for our residents and their family members as possible. So we're talking about some outdoor areas that will allow for some resident socially distanced visitation. So a lot more to come on that. Also, as Daryl mentioned, our Mother's Day event was a lovely event. Thank you for everybody who helped with that. When you're outside of work, we did want to speak on specifically how to keep yourself safe outside in the community. So we know that when you're here, you've got all the PPE that we supply. You've been trained on how to use that and what's appropriate in each specific situation. It's equally important that when you're outside of the building, you're following all the CDC guidance at that time as well. And so what we would really ask is that all of us, by choosing to work in healthcare, we really have an obligation to protect our residents and our peers to make sure that we are keeping each other as safe as possible so that we can continue to work in our capacity and so that we can try as much as we are able to accomplish to keep this illness outside of our locations and to protect our residents as well. So when you are out in the community, please make sure that you're following social distancing guidelines at those times as well. Limit those outings into the community. Obviously, if you have medical appointments or other things that you really must attend to, we certainly understand that. But when you do that, please make sure that you're social distancing, that you're wearing a cloth face covering as directed, that you're doing really good hand hygiene, and that you're staying away from anyone who has symptoms of illness at that time. We would ask that you educate your family as well, or those that you live with, because we need to make sure that that risk of exposure is controlled as much as possible. If you do become aware that you've had an exposure or that a loved one or member of your family has had an exposure, please communicate that with your manager, and we'll look at those situations to determine what the appropriate next steps are. As soon as you're available to share that information, we would want to know that so that we can work through that process. We are working on updating our screening tool. So that screening tool has evolved over time and based on CDC and Department of Health guidelines will continue to evolve over time. So just a reminder, please read that screening tool. Obviously, if you have symptoms of illness when you present for your shift or in the course of your shift, we do not want you working in our facilities at that time, and you would need to report that to your manager immediately so that we can follow up on that as well. Did want to mention guidelines on having a second job have not changed at this point. So we do ask that people avoid having a second job because of that heightened risk of exposure. And the risk of exposure is highest when you're within 5 or so feet of people for a period of 5 minutes. So that's about 2 arms length, that 5 to 6 feet distance. So that is what's important to avoid and to minimize. In regards to mass testing, we anticipate that there will be a future potentially mass testing event or a random testing. We're not exactly sure what the details of that will be. We did that testing under the guidance from the Department of Health, and we will continue to test based on what their guidance is. So as we look to get those results, we'll certainly know more and share more as that information becomes available. As far as wanted to touch on admissions to our facility, we are testing and ensuring a negative test for all the admissions coming into our facility, and we'll continue to do that going forward as long as that guidance is in place as well. And so the big push is to reduce as much as possible the risk of this illness coming into the facility, primarily by staff. We're going to be the most likely ones to bring it in, and then also as much as needed by residents as well. So then just to wrap up a little bit, that exposure risk, again, if you become aware that you've had exposure out in the community, please call us right away and check with us, and please keep your eye on that screening tool so that as that evolves and changes, you are well aware of what it says and following those guidance as far as not coming into work when it's not indicated. Thank you.